Good morning. Hi, my name is Patrick Woodcock. I'm the president and CEO of the Maine State Chamber of Commerce. I'm going to do quick introductions and provide a overview of where we are with the commencement of one of the most significant rulemakings in decades for the state's labor laws and ultimately for our employees and employers. Let me first by introducing the businesses that we have today. Joining me is Paul Bolin, who is Senior Vice President and Chief People Administrative Officer, Northern Light Health. Kathy Callahan, who is Safety and Human Resource Officer at Martin's. Fred Forsley, who is owner of Shipyard Brewing, Sea Dog Brewing, and the Inn on Peaks Island, and Jill Moses, the owner $3 Dewey's and Saltwater Grill. I'll just start before I turn to the businesses joining us today for some context of where we are in terms of process. As many of you know, the paid family medical leave law, which nearly a dozen states across the country have implemented, was passed in 2023. And 2.5 weeks ago, the Department of Labor has filed the proposed regulations, which commences a 45-day public comment period. The business community wants to be collaborative in the implementation of these regulations. This needs to work for employees and employers alike. Thankfully, there are many examples of states that have successfully implemented paid family medical leave. And we do think that there are models that can work for both employees and employers. However, the proposed regulations fail to utilize these best practices in a few key areas. And also, we have concerns that it fails to adopt some of the key provisions that the Maine legislature included to recognize the unique characteristics of the business community in Maine. To start, one key aspect to give the baseline here is the law establishes that contributions, so the new funding mechanism for the paid family medical leave, will commence January 1. It's up then for the Department of Labor to determine when the benefits will initiate. During the legislative debate, there was significant discussion about how this new paid family medical leave benefit would interact with private plans. And we are extremely disappointed that the Department of Labor's proposal fails to allow the businesses that have been doing the right thing for many of their employees by providing paid family medical leave will not be able to avoid these new taxes, and their employees will not be able to avoid these contributions. This is unlike two states, Massachusetts and Connecticut, that allowed the private companies to maintain their private plan and avoid these contributions as the programs were stood up. We're talking real dollars. The estimated annual costs of these contributions is well over $300 million. And ultimately, this will be borne by businesses not expecting this and employees not expecting this unless the Department of Labor changes this proposal. The second issue was very specific to the state of Maine, which included language recognizing that we have a unique situation with a lot of, first of all, we have a very scarce labor supply that included language that allows a notice to an employer if an employee is taking advantage of the paid family medical leave benefits. However, it includes in the statute that use of the leave must be scheduled to prevent undue hardship on the employer as reasonably determined by the employer. We have very unique businesses, small businesses across our state, yet the rule fails to recognize and really is in contradiction with the statute in saying that under the regulations, an employer claiming an undue hardship with respect to the scheduling of foreseeable leave has the burden to prove the undue hardship. It really should, as the statute recognizes, be the ability of a business to determine what is a hardship that is reasonable. We have thousands, over 75% of Maine businesses are small businesses, and we really need to have a recognition that every business is different and allow them to make reasonable uh, accommodations for hardship in our economy. We want to be a partner in addressing these issues. We will be uh, participating in the public hearing on Monday, but these are real consequences to Maine businesses and ultimately the employees. We want to make this work for both the business community and our employees. And ultimately, we are hopeful that the Department of Labor will listen to these concerns and make these revisions to what will be the most significant regulation proposed in over 2 decades in the state of Maine. With that, I'm going to turn to Paul Bolin, again with Northern Light, for the impact on his organization. Paul?
So I appreciate everyone's time today. From Northern Light's perspective and other employers around the state, there are a number of issues that Patrick enumerated that are of concern. In particular for us, we have a benefit package for our employees, short-term disability and other coverage that surpasses what's required by law. And in this new in the rulemaking process in the legislature, it was clear that the intent was those employers that offer a plan that's equivalent or even better than what's mandated by the state wouldn't be required to pay for that plan for their staff, as well as this new tax. And their employees also wouldn't be taxed because they have a plan that they enjoy and participate in that's employer funded. And so in looking at the new rulemaking, that isn't the case as proposed by the Department of Labor. The proposal is that at least for the first 16 months, that all employers, even those with a more generous plan, provide this new payroll tax. And that doesn't sound like on a percentage basis a lot, but for Northern Light Health, it's $1 million a month, this additional tax that we'd be paying for a 16-month period. So about $16 million of unanticipated expense that simply is not affordable. We want to continue to offer a plan that is very generous and surpasses what this new law would require, and we want to do that in a way that allows us to continue to do that. But right now, it seems that the proposed rulemaking from the Department of Labor would indicate that we would essentially have a penalty to pay for two benefits when our staff are only using one.
Thank you. Paul, maybe turn to Kathy now. Kathy. You're on mute, Kathy.
Okay, thank you. I echo the previous concerns, and Martin's has a few concerns here. I am concerned about the very loose definition of affinity relationship. Definitely, we understand medical leave for employees, and we more than comply with the Family Medical Leave Act. We even go above and beyond and give people additional personal leave for themselves or family members when they need it. I'm just worried that this affinity relationship, the definition could be abused. I'd like to see it tightened up a little more. I also am concerned it includes part-time and seasonal employees as well. The majority of our part-time and seasonal employees don't want full-time, but they want a little extra money and they don't want benefits. They don't want to pay for anything extra. They really care about their take-home pay. We offer an affordable short-term disability plan right now. I echo what Mr. Boland said. We're looking at a private plan to see if it would be better than the state plan and implement that. But the potential cost of double paying again is going to be hard for us to do. So, and the other thing I did notice in the proposed rules, notice to employers. The employees will get notice of whether their leave has been approved by the fund, but there's no mention of language that says the employer will get notice. So potentially an employee could tell us, I'm going to take a leave and I'm going, and we'll never know was it approved or not. So I think we want to be a partner. We want to work with this. We want the best for our employees, but I think it needs more work. Thank you.
Thank you, Kathy. And let me expand on a few of those key points. The specific mention of affinity, I think intuitively we all understand what caring for loved ones means. That's our family, our very close friends. It becomes harder when you're developing a statute of when there are non-traditional family structures to ensure that those individuals can care for somebody who has been father, who has been a mother. We all recognize that. The issue is when people do not uh, uh, sincerely utilize the program for those purposes, but abuse the program for individuals that really is not in the spirit of the law. That needs to be, we need to have good data of who is utilizing that. And ultimately, we do need to have some self attestations that people are not using these affinity relationships for multiple people. These are significant benefits, and we need to police it with the due recognition that these are significant payments by all employees and all employers. And in addition, Kathy mentioned one specific provision that we are concerned that if an employee puts in a request, that there is an automatic notification to the employer. This is another way to ensure that these benefits are being utilized consistent with the spirit of the main paid family medical leave. With that, I'm going to turn to Fred. Fred, please.
Hi, thank you. And I do reiterate the key points about that were mentioned. We don't provide benefit for family leave. We do for women that are pregnant women, as well as people that are injured that want to take time off. We're self-insured in our health insurance plan. It's been very expensive and it's been very beneficial because it retains employees. Presently, right now in the state of Maine, this is unworkable for the restaurant business. It'll be catastrophic. We are under supplied with employees at every one of our locations. If you did this seasonally and somebody could take June, would really only make money in the state of Maine in the restaurant business from June to September. Every one of our locations lose money January, February, March, April. If people right now at a restaurant and you're understaffed are able to not even basically give you minimal notice when it's taking weeks to fill these positions, and we're having to use people from Jamaica and a variety of other places to fill these spots, I don't know how it's workable. And unfortunately, so many restaurants have closed in the state of Maine in the last 24 months, and we're still not over the impact of the pandemic. And I can tell you from firsthand knowledge, it's difficult. We'll survive because we always have, but there are a lot of friends of mine in the industry, in the restaurant business, that one, don't even know about this presently, haven't been given enough notice. I think the press has to do a much better job at getting out all these points. There are so many people I talk to that I say, do you realize that 1%, half from you, half from your employer, are going to be taken out of your paycheck? And they have no idea. This is as major of an event this is to not have been fully covered so that the public could get more involved and give more comments. Yeah, if you're very in tune, if you have people that are connected to Augusta, or if you're in one of the associations, you know. But for the guy that's got a restaurant and he's working it in there and he's got 30 employees, this is going to hit him at a time when he's already been overtaxed with increases in your food supplies, just doubled almost, and that's been a dramatic thing. I mean, we're already charging $18, $19 for a hamburger. How are we going to withstand this? I think somebody needs to think about what the pandemic did to the restaurant business. And I honestly think that the labor department needs to look at exempting some different classes that really have not been able to get back up to near full employment. The restaurant business is a best case 70-80% employed right now, especially when you look at behind the scenes in the kitchens and whatnot. It's I really feel this is going to be detrimental, and I think an extra 0.5% out of everybody's pay is going to be felt by our employees, and they're already struggling to pay all the other aspects of the increase of inflation. So really think we need more time to study this and extend. I also, we talk about things like how this could get, there's going to be 16 months that everybody's going to have to pay in and not be able to get the benefits. There should be another form to fund that, potentially the state. But, at the end of the day, right now, I think this has been sprung, especially on people that aren't always in tune with what's going on in Augusta. And honestly, I think there needs to be a real evaluation of how this hits every industry, but especially, the restaurant and hospitality business is the number one industry in the state of Maine right now. And they're just not prepared to withstand, and forget paying for it, just the actual loss of labor without any major notice and being able to recover from that can be difficult. Thank you.
Thank you, Fred. Now we've heard, I think that really punctured what is different for hardship is very different depending on what business, the state of that industry. The restaurant industry clearly has gone through a period over the last 4 or 5 years that is historic in challenges, and recognizing what a hardship is for a specific restaurant is very different than another business in the state. I'm going to turn to Jill now. Jill.
Hi, I'm mostly going to reiterate what Fred just said. The bulk of our business is 120 days in the state. That's where we make the most of our money. We bring in several seasonal employees, and the way it is right now is those seasonal employees can then go out on paid Family Medical Leave Act. The way it is right now is we don't, like Fred said, if we're staffed fully, it is a fabulous day and we hold our breath, and tomorrow might not be the same. I have heard from many people in the state saying, I wouldn't suggest hiring or replacing them because you have to keep their job. Well, that's just impossible. There's no way that we can be fully understaffed in the kitchen. So that doesn't hold in the restaurant industry. We have to have a staffed kitchen, and that is very difficult as it is without, 3 months off in the summer. So that's one thing. And then I'm over here at Saltwater right now, and I was asking some of our employees this morning, and not one of our staff member knew what was going on. And the looks on their faces when I said that 0.5% of their paycheck is going to go towards this for 16 to 18 months without being able to use that benefit, it's not great. The cost of living in Maine has gone up, groceries, childcare, everything has gone up. And now to add this onto them, it's just not workable. And people are already stretched thin in the jobs in the restaurant industry. And we do our best to get a fully staffed restaurant, but it's nearly impossible. We agree that everybody should have paid time off for medical leave and for giving birth and for family members, but it just seems as though the rulemaking and the decisions behind this hospitality was not taken into consideration. So it's just frustrating on our end. And so that's all.
Thank you, Jill. Just to give some statistics on participation and awareness from businesses, since the law has passed, the Maine State Chamber of Commerce has held 3 webinars on the law and the rulemaking process. It has been one of the most widely attended webinars that we've ever hosted. Yet the hundreds of people that have joined is only a small piece of the business community. The small businesses and the employees that will be impacted by this, this needs to be headline news now. It is going to be one of the most consequential uh, impacts on the main economy in years. And ultimately, we need to have the input from the business community to reconstruct what has been an initial proposal from the Department of Labor that will only exacerbate the challenges of implementing this law. We think there are models from other states that have worked better, and ultimately, we need to recognize the state, the fragility of our restaurant industry and the entire economy with a very tight labor market. With that, if there are any questions from the press, thank you for joining, and would turn over to the press if there are any questions for the chamber staff or for the businesses with us today.
I do have a question. Susan Cover from Spectrum News here. The substitution of private plans issue that you're raising. So basically, I'm looking at the language right now. You guys would have to pay in for a year, and then you can apply for an exemption, but you wouldn't find out whether you qualified for the exemption until April 1st, 2026. Is that right?
That's correct, Susan.
Okay. And was it your understanding when the law was passed that that was going to be the case?
So I think there was an expectation that for a lot of these employers that had paid family medical leave, that you would be able to maintain your private plan, meet the state equivalent, and avoid this tax. Um, and that was based on some of the legislative discussions, but also how other states have implemented it. I want to see if Paul, do you want to add anything to that for the discussions in the legislature?
Yeah, so I participated in some of the listening sessions. I was part of a small group that even met with the legislators who drafted the proposal and with the governor. It certainly wasn't clear that the intention would be that that businesses, even those that provide a more substantial benefit, would also have to pay this tax. That was specifically something that was not understood or explained, and I don't think that was the original intent from the legislature. So I do think that this part of the rulemaking that the Department of Labor has put in is really looking for a funding source that really is not appropriate for this benefit. It should be funded by the benefits should be funded by the businesses and staff that are using it, and not by those that aren't. But having 16 months where we pay a tax, and again, Northern Lights portion of that tax would be, up to $1 million a month, really is untenable. And so we want to make sure that we're able to continue to provide very generous benefits to our staff, and that really compromises our ability to do that.
Okay, thank you.
I have a quick question. Yes. This is Joe Lawler from the Press Herald. By the way, thanks for doing this. It's nice to hear stories from business owners, managers, et cetera, about how this is impacting you directly. I could look this up, but I'm hoping you know this offhand. There was some discussion about employees taking the benefit shortly after they started a job. Do you know, can they do that right away, or is there a certain amount of time that they have to be working a job before they can take the paid leave? And then also, how much notice do they have to? I mean, can they say, okay, next week I'm on leave? Is there any how much notice is there given?
Thank you for that. And those are some detailed questions that it might be helpful to have a written response. I can take the second one first, and maybe Jake, if you want to address the first part. But under the proposed regulation, there is an emergency ability for someone to claim paid family medical leave benefits. It's a little, as you can imagine, these circumstances, you want to be reasonable. However, can you always claim the emergency for a paid family medical leave? But the regulation does include a 30-day request is within the definition of a reasonable period if it's not within an emergency declaration. Is that helpful? Um, uh, the the real issue is we do think that there should be a third party or a medical doctor or someone within that period. Clearly, if there's a loss of life in the family, that is obvious. But if it's a sick leave or medical leave, we do need to have some third party um, attestations that this is actually occurred and does need to meet this emergency threshold. Jake, do you want to add anything to that?
Yeah, my name is Jake LaChance. I'm a government relations specialist handling labor issues for the Maine State Chamber of Commerce. To answer your first part of the question, there is no set amount of time that needs to be given in terms of an employee working for an employer where you're able to take the benefit when you start working for them. It's just after 120 days that job is protected, and it's a there's no protection for the employer in terms of them having to keep that job for them after the 120 days. So the employee's job is safe after the 120 days. It's just not safe if they take it before the 120 days, and but there's no preclusion to them taking the leave.
Was that helpful? We'd be
Yeah,
happy to follow. We'd be
I
happy to follow up
understand.
too. Okay, thank you.
I was just going to ask too, if you could one more time explain the hardship, the issues with the hardship clause that you were mentioning. I didn't quite understand what you were saying there.
Yeah. Okay. So this is unique to the Maine law, that in the statute it was written to utilize the paid family medical leave benefits. It was written in the statute that, and I'll read it and then pause and then try to do an explanation. But it says, notice to employer, absent an emergency. We were just talking about the emergency provision. Illness or other sudden necessity for taking leave, an employee shall give reasonable notice to the employee's supervisor of the employee's intent to use leave. Use of such leave must be scheduled to prevent undue hardship on the employer as reasonably determined by the employer. So that is as clear as day of the who has the authority to make the decision of whether this leave is causing a hardship. It is the employer. However, the regulations that came out 2.5 weeks ago says that an employer claiming an undue hardship with respect to the scheduling of foreseeable leave has the burden to prove the undue hardship. So they've created a whole standard that you have to go to the Department of Labor and make the case that this is going to be causing a hardship for your business. There aren't really, if you read the law, it should be determined by that employer with reasonable explanations. There shouldn't be a quasi-judicial review of determining what the business thinks is a hardship for their business.
I got that. Thanks for explaining it one more time.
Sure.
If it's appropriate to ask this, we were hoping to get a photo with the story. I'm wondering if Jill Moses, since your businesses are right in downtown Portland, if you'd be willing to get your photo taken this afternoon.
Sure,
Jill? Yeah,
sure.
I do this right here, but would say 2 o'clock at $3 Dewey's be okay? Is that workable, or what's a good time?
Nope, that's fine.
2 o'clock at $3 Dewey's. Okay. Thanks a lot.
well, I do want to, if there aren't any other questions, I do want to thank the press. This is a complicated issue. It's fairly technical, but the huge ramifications for our labor force, for employees. This is a tax on employees and employers. Jill made that point, but this is going to impact everybody, and it is happening very quickly. So do appreciate everybody's engagement on this with the right in the throes of the regulatory promulgation at the Department of Labor. If there are any other questions, I do want to thank everybody again, and please follow up with any questions.